I'm Jade, and with me I have Zeleda and Faith, and we are presenting valvular heart disease. The heart valves play a very important role in ensuring blood flows in the correct direction to the heart by preventing backflow. The heart valves include the tricuspid, mitral, pulmonary, and aortic valves. Patients with valvular heart disease, which is the damage of valve or valves affecting the flow of blood. This can be the cause of either the valve fails to close properly or the valve is unable to open all the way. Valvular stenosis is when the valve is constricted and narrowed so blood cannot flow forward. Valvular regurgitation is also known as insufficiency or incompetence, but it is when the valve cusp fails to shut completely, allowing blood flow to continue even when the valve is presumably closed. Just remember that regurgitation is a leaky valve, while stenosis is a narrowed valve. And lastly, a heart valve disease can happen at birth. Atresia is when the valve opening doesn't develop normally during childhood. This prevents blood flow from passing an atria to a ventricle or from a ventricle to a pulmonary artery or aorta. The blood must find another route. This is just a quick slide of what a tricuspid atresia blood flow may look like. As you can see, the blood has to find another route to take. I wanted to provide a simple heart diagram to help the visualization of where these heart valves are located. The tricuspid valve is located between the right atrium and the right ventricle. The pulmonary valve is located between the right ventricle and the pulmonary artery. The mitral valve is located between the left atrium and the left ventricle. To keep in mind that the mitral valve has only 2 flaps, whereas the tricuspid valve has 3 flaps. Next, the aortic valve is located between the left ventricle and the aorta. How it works is when the heart muscle contracts and relaxes, the valve will then open and close, letting the blood flow into the ventricle and aorta at alternating times. The pathophysiology for valvular heart disease is when the blood flow is compromised because of the valves, the consequence is that cardiac output is also compromised. The common heart valve disorders would be mitral regurgitation, mitral stenosis, aortic regurgitation, and aortic stenosis. The etiology or the cause of valve disease would be from rheumatic fever, endocarditis, mitral valve prolapse, and even papillary muscle prolapse. Rheumatic fever and endocarditis are the most common cause of valvular heart disease because they can cause damage, vegetation, or thickening and scarring of the heart valves. To go more into detail, the most common manifestation of aortic stenosis are congenital bicuspid. The picture to the right is a visual of what it may look like. It is when a person can either be born with it, or over time the valve fuses together. In a normal aortic valve, there are supposed to be 3 flaps, and instead, the bicuspid aortic valve has only 2 flaps. The cause can be from either getting older or having rheumatic heart disease can cause aortic stenosis. Mitral stenosis is commonly caused by rheumatic fever. As in the last slide, rheumatic fever causes thickening and scarring of the heart valves. Next, aortic regurgitation can be caused by an infective endocarditis. An infective endocarditis is an infection in the heart valves or endocardium, usually caused by bacteria entering the bloodstream and infecting the heart. The most common bacteria are streptococci, staphylococci, and enterococci. A dilation of aortic root from hypertension and aging can also cause aortic regurgitation. Lastly, a mitral valve prolapse occurs when the flaps of the heart's mitral valve bulge, also known as prolapse. It is commonly described to look like a parachute into the heart's left atrium as the heart contracts. A normal mitral valve has 2 flaps, so when one or both flaps have an extra tissue or stretch more than normal, it is what causes it to look like a parachute. This will lead to a mitral regurgitation. Mitral valve prolapse is a lifelong disorder and can happen at any age and is common with people with this valve malformation are even surprised to learn that they have a heart condition because they can go many years without experiencing symptoms. When these manifestations are left untreated or poorly treated, can cause atrial or ventricular hypertrophy. Since the heart muscle needs to work harder to force the blood past the valve, this can cause the muscle to thicken, called hypertrophy. Next effect is left-sided heart failure, noticeable by the pulmonary edema, decreased coronary blood flow, which will then lead to a myocardial ischemia. Quick overview. So, mitral regurgitation is when the mitral valve cannot close completely. It will then flow back into the left atrium. And opposite, mitral stenosis is when the mitral valve cannot open fully or is narrowed. Blood cannot get into the left ventricle. If this is severe enough, it can put back pressure on the lungs. Next, aortic regurgitation doesn't allow the aortic valve to completely close, leading the blood to backflow into the left ventricle. Aortic stenosis is when the aortic valve cannot open fully or is narrowed, therefore, blood cannot fully reach the left ventricle. Here's a quick question. A mitral regurgitation backflows into the A. Right atrium, B. Right ventricle, C. Left atrium, or D. Left ventricle. So we know the mitral valve is located between the left atrium and the left ventricle. So we could cross out A and B because it's not the right. So regurgitation is a backflow. So you're not going to be able to reach the ventricle since it's backflowing. So C is the right answer, left atrium.
We're going to go over a few key concepts that you should be aware of. A murmur is the first. When you listen to a patient's heartbeat, you'll normally hear the heart make a lub-dub sound. When someone has a valvular disease, however, they won't be able to make that normal sound. Instead, you'll hear a swishing or gurgling sound caused by turbulent blood flow due to the heart's valve's inability to completely close or open. Diastole is the relaxation phase of your heart. What's going on here is that your heart's atrium chambers are filling up with blood, which then flows into your ventricles. The phase of the heart during contraction is called systole. Your heart, specifically the ventricles, contract to force blood through your valves and into your aorta or pulmonary trunk, as you may recall from A and P. The term stenosis refers to the inability of a valve to completely open. Blood can pass through your valves as a result of this, but only a small amount of it can. Regurgitation occurs when your valve should be closing but is unable to do so completely. This is leaving a space for blood to be able to return from the ventricles back into the atrium. This is problematic because blood should only flow in one direction. Blood will begin to backflow if your valve is unable to completely close. It's important to point out that the majority of people with valvular heart disease have no symptoms at all. It is usually when cardiac output is compromised that they will show up to the doctor's office complaining of shortness of breath, chest pain, weakness, and fatigue, but really unsure of what is going on with their body. As a result, low cardiac output is a common denominator to the signs and symptoms. Fatigue or cyanosis may result from the valve not fully opening, allowing only a small amount of oxygen-rich blood to perfuse your tissues. A lack of blood flow perfusing your lungs and brain can also cause chest pain, lightheadedness, or even fainting. Because your heart must now produce greater pressure to pump the blood through the tight valves, you may experience shortness of breath as a result of the valves not opening or closing normally. This high pressure can be transmitted back into your lungs, resulting in a feeling of shortness of breath. Swelling is another symptom. When valves are not working properly, there is insufficient cardiac output, which prevents tissues from being perfused. This may lead to right-sided heart failure, which causes peripheral edema, including swelling in the ankles and feet. And lastly, the heart is trying to compensate for the low cardiac output by beating faster in order to get more blood out to your tissues, which causes an increase in heart rate. Hearing the heart with a stethoscope is probably the most important assessment, and it is the easiest way for a nurse to identify a valve disorder. There is a technique which will allow you to identify which kind of murmur your patient has. First, ask yourself, Which valve are you listening to? Remember that placing your stethoscope in different areas of the chest will allow you to hear the different heart valves. And here's a picture explaining where to find those different points. Second, determine whether the murmur is heard during the systolic or diastolic phase. Third, ask yourself, what should the valve be doing in this phase? The tricuspid and mitral valve should be closed during the systolic and open during the diastolic phase. The pulmonary and aortic valves should be closed during the diastolic and open during the systolic phase. If the valves should be closed, you have regurgitation. If the valve should be open, you have stenosis. For example, if your mitral valve is open during the systolic phase when it should be closed, this indicates that you are dealing with a mitral valve regurgitation. Hearing a murmur is an important step in assessment. But what does a heart murmur sound like? There is a difference in sound between a regular heartbeat versus a heartbeat with a murmur. Other assessment points include asking the patient whether they have a prior history of rheumatic disease, as this puts them at a higher risk for developing valvular disease since they have already dealt with a damaged valve before and have a potential of it happening again. Painting sputum can develop in the patient from lung congestion due to the backflow of blood. Orthopnea may be experienced by the patient, which is caused by blood moving to the chest area while lying down. It's worth noting that if your lungs are already congested, adding more blood volume will make you feel as if you cannot breathe while lying down. As you can see, valvular disease and heart failure share many of the same signs and symptoms, and valvular disease can lead to heart failure if left untreated. One important thing to consider when assessing your patient is to be aware of any sudden shortness of breath, anxiousness, chest pain, or any new murmur. These, when experienced together, can be a cause of papillary muscle rupture. This is a life-threatening situation that must be addressed immediately. Recall that the papillary muscle holds and supports your valves, so if it ruptures or becomes damaged, your valve will no longer be supported. Let's review this question. The nurse expects that a client with mitral stenosis would demonstrate symptoms associated with the congestion in the A. aorta, B. right atrium, C. superior vena cava, or D. pulmonary circulation. When a patient has mitral stenosis, blood will have a hard time getting through the left atrium and into the left ventricle. This will cause a backflow of blood through the pulmonary vein and into the pulmonary circulation, causing an increase in pressure and congestion. So the right answer is D, pulmonary circulation.
A couple tests that can be done to diagnose valvular disease could be either an echocardiogram, an electrocardiogram, a chest x-ray, or a cardiac catheter. The echocardiogram is the golden test. It will image the heart in real time. An echo machine also has different modes to choose from, and one of those modes can create a visual of what the actual flow of blood in your heart looks like. And with this, we can see if it's traveling in the right or wrong direction and diagnose if it's mild or severe regurgitation or stenosis. An electrocardiogram or EKG can indicate any arrhythmias. Next, the chest x-ray, you can tell if your heart has enlarged. And in the picture provided, in the middle of the chest x-ray, the white part indicates where the heart would be. And you can see that it takes up more than 50% of the thoracic cavity. This proves that the heart has enlarged. And we also call this cardiomegaly if the heart has dilated or become larger. Next, a cardio catheter is a bit more invasive, and we save this for last if no other test helps. How it works is that a professional would stick a catheter in a major artery, such as the femoral artery, so it can be directed through the aorta and then to the left side of the heart. At the end of the catheter would be a tool to measure the pressure across different chambers and pressures of the valve that separate the chambers. Surgical interventions include fixing the opening or closing of a deficit valve. This can be accomplished by performing a balloon valvuloplasty procedure, which involves inserting a balloon through a stenotic valve. Valve repair is performed on any valves that are drooping or not completely closing. A mechanical or biological valve, such as a pig valve, may be used to replace the whole valve entirely. For valvular disease, this procedure is currently the treatment of choice. When given a valve replacement,
The patient should take anticoagulants for the rest of their lives to prevent clots from forming around the new foreign object in their body. Here are some pictures showing the different kinds of valve treatment options. Balloon valvuloplasty is performed when a valve is rigid or will not open all the way. A balloon is inserted through the valve by a catheter and is inflated to help it increase the opening, allowing for better blood flow forward. In valve repair, a harpoon device is inserted through the chest and inside the mitral valve to perform a minimally invasive procedure. Surgeons place the device on the mitral valve leaflet and stabilize it with cords that are sutured into the valve and are then tensioned and adjusted to help realign the valves so that they can open and close properly. With valve replacement, you can see here that this is a mechanical valve. How they work is when the ventricles contract, the pressure pushes the ball upwards, blocking the hole on top of it and preventing blood from flowing backwards. I inserted a cartoon picture of aortic stenosis here that quickly rephrases what I just went over. So in normal conditions, your aortic valve should be completely open during systole, but in this case it is not, obstructing left ventricular outflow. As you can see, blood is trying to get through, but the valve has a very narrow opening which prevents blood flow from going through it. This can lead to possible heart failure, angina, and syncope. And the treatments include replacement of the valve, repair of the valve, or balloon valvuloplasty. Here's a review question. A 75-year-old patient will be undergoing a mitral valve replacement for severe mitral stenosis. When reviewing the patient's chart, which of these infectious diseases would likely be present in the patient's history? A. Meningitis, B. Rheumatic fever, C. Varicella, or D. Haemophilus influenzae. Well, meningitis is an infection and inflammation of the meninges. This is going to affect your brain rather than your heart, so you can eliminate this one. Haemophilus influenzae is a bacteria that affects your lungs, bones, joints, and skin. This bacteria actually causes meningitis and does not affect your valves, so you can cross that one out. Varicella is a virus that affects your skin. This has nothing to do with your heart valves, so you can eliminate it also. The correct answer is rheumatic fever. Remember that a patient with prior history of rheumatic fever is more at risk of developing a valvular heart disease.
Hello class, this is Faith and I'll be covering the next topic on patient education. In valvular disease, there's no official medication treatment to cure it. In order to effectively manage the diagnosis, we need to educate the patient about the risk factors and recommend healthy lifestyle changes to help cope and prevent future damage from progressing. Listed here are some of the major factors of valvular heart disease, which include older age, history of certain forms of heart infections, heart disease, or heart attack, family history of heart disease, any underlying conditions such as high blood pressure, cholesterol, or diabetes, congenital heart disease, which is present at birth, and sedentary lifestyle, which is lack of physical exercise. The more at-risk patients for valvular heart disease are the elderly, or who have a history of heart attack, heart failure, endocarditis, or rheumatic fever. It's important to note that based on estimates, 1 of 8 people aged 75 or older will suffer from a moderate form of valvular heart disease. That's why patient education is so important to help prevent any form of disease from happening early on. We will educate patients by teaching them to incorporate these 6 strategies into their lifestyle in order to reduce the risk of valvular heart disease. 1. Importance of a healthy diet and eating healthy foods. 2. Recommended daily and weekly exercise by a physician. 3. Smoking cessation. 4. Controlling and maintaining underlying conditions from worsening, which includes high blood pressure, high cholesterol, and diabetes. 5. Maintain proper dental hygiene. And 6. Consulting their doctor for any changes in health. In the following slides, we will be going through each teaching point more in detail. Number 1, healthy diet. Eating healthy is important for good heart health. The best way to help lower blood cholesterol levels and high blood pressure is to eat less saturated and trans fats, avoid cholesterol, and maintain your weight through a well-balanced diet. We will educate the patient to eat a variety of fruits, vegetables, and grain products, especially whole grains, reduce sodium intake by eating less than 6 grams of salt a day, consume fat-free and low-fat dairy products, good proteins like fish, beans, skinless poultry, and lean meats are better than red meats, limit foods high in saturated fat, trans fat, and cholesterol, and have no more than 1 alcoholic drink, no more than half an ounce of pure alcohol per day for women, and no more than 2 drinks for men. Number 2, exercise. We want to educate and encourage patients to stay active. For most healthy adults, the Department of Health and Human Services recommends getting at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous aerobic activity every week. This averages to about 30 minutes 5 times a week. Ways to move include walking, running, dancing, water aerobics, sports, yoga, leisure activities, anything to get the body moving, no matter what age. Number 3, smoking cessation. According to the American Heart Association, cardiovascular disease accounts for about 800,000 US deaths every year, making it the leading cause of all deaths in the US. Of those, nearly 20% are due to cigarette smoking. If the patient is a regular or avid smoker, we need to educate them to stop smoking as soon as possible. Quitting can prevent their chances of developing lung and heart complications, including valvular heart disease, and can potentially save their life. Let's take a minute to answer this question. An overweight 40-year-old female patient is admitted to the ER for chest pain. She has a history of smoking along with signs and symptoms of high cholesterol and stage 1 hypertension. The patient expresses that she wants to make a serious change in her lifestyle, especially since she has a family history of heart disease. What is the most appropriate response the nurse should say when first advising the patient? A. You should decrease smoking and sedentary lifestyle from this point on. B. The first step to a healthier heart is a change mindset. C. The first step to a healthier heart is to stop smoking. You can also start implementing a healthy diet and exercise as well. D. The next step to bettering your health is a decreased daily sodium intake and exercise. Answer choice C would be the most correct answer or response the nurse should say when advising the patient. Number 4, controlling underlying conditions. If a patient has underlying conditions such as high blood pressure and hypertension, high cholesterol, or diabetes, we want to educate them to not only make healthier decisions in diet and exercise, but to also maintain and monitor their conditions from worsening. Uncontrolled underlying conditions may lead to worsening or additional complications that may lead to valvular disease. For example, health threats from high blood pressure include stroke, heart failure, heart attack, or vision loss. We want to encourage patients to know their numbers, monitor their underlying conditions, and seek medical attention, especially if there is a hypertensive crisis. Number 5, dental hygiene. Did you know that tooth loss patterns are connected to coronary artery disease? Believe it or not, poor dental health increases the risk of bacterial infection in the bloodstream, which can ultimately affect the heart valves and sometimes even lead to endocarditis. We want to educate patients to maintain proper dental hygiene by reminding them to brush their teeth at least twice a day and floss at least once a day. Regular dental checkups with their dentist is vital to maintaining dental hygiene. This is especially important for patients who have an artificial heart valve or have any other underlying conditions. Number 6, consult doctor. We want to educate patients to maintain their routine and annual checkups with their doctor and consult them for any changes in health. Patients should inform their doctor of any underlying conditions and ask for suggestions about additional strategies to maintain an optimal, healthy lifestyle free from valvular disease. Okay, class, here's your final question. True or false? Poor dental hygiene decreases your risk for valvular disease. The answer is false. Poor dental hygiene actually increases risk for valvular disease, such as endocarditis. Lastly, we want to educate patients that there are amazing organizations like the American Heart Association and Living with Valve Disease who cater to educate, provide helpful resources, and community support for patients with heart disease. We would like to conclude our presentation by reminding you and our patients that a healthy lifestyle is key to maintaining a healthy heart and body. Thank you.